Good afternoon. Welcome to Bobo 103.1 FM. Dane hanging out with you, and every single week we have a very special guest that's joined us here in the studios, in the Bobo studios to be exact, to talk about all things HSA, whether it be their critical job that they play, their role that they play, maybe a specialty, or maybe there's a conference that's upcoming. Whatever it is, this show is dedicated for an hour to HSA. We have a very special guest in the studios joining us this afternoon. I'm going to have him introduce himself, his role that he plays at HSA, and how long has he been with HSA, to be exact. I know a lot of the employees that we get here are past the 20-year mark, 15, going all the way to 10. Seems to be a job that everybody, or a company, I would say, that everybody enjoys. Good morning.
Good afternoon. I'm Dr. Carl Brown from the HSA. I'm an anesthesiologist and intensive care physician. I've been with the HSA. That's actually a complicated question. I've been with the HSA for 7 years continuously, but I've had a visiting relationship where I've practiced there for 6 months to a year at a time for the last 10 years.
So you'd say even more. You've been there a longer time,
yeah.
Right? Because did you intern at a young age?
I did internship in Jamaica.
Yeah, okay.
But then during my residency, which was also in Jamaica, I had some time where I practiced as an elective period in Cayman. And then once I finished with my residency, I came and practiced for a year before going off to fellowship and then ultimately returning.
How long have you been in the medical field now? Like, give or take, since leaving high school and just jumping into university, and then
from the start?
From the start. Like, how long have you been practicing?
Well, I've been practicing since 2009. So that's 16 years?
Yeah.
16 years. Yeah.
Been a while. Do you think about that? Like, how long has it been?
It's kind of flown by, it's not something that I spend much time with,
Yes.
Life is life, and,
Yeah, it is. It is. Do you enjoy doing what you do? I ask everybody this question, but I really want to know if you enjoy doing what you do.
I do. I do. It's pretty gratifying. Yeah.
Yeah. Amazing. Now, a special day is coming up. Won't you let us know? It's going to be on the 16th.
That's right.
This month, yeah.
World Anaesthesia Day.
Yeah.
It's a day where you can take the opportunity to appreciate your anesthesiologist, or appreciate the field of anesthesiology and what we bring in terms of benefits for the perioperative period and for patient comfort.
Love it, man. Okay, let's start off. Very easy process here in the interview. Let's start off by saying, explaining your role and how critical it is to healthcare.
Okay, so the role of an anesthesiologist is it's around pain. So our focus is pain. We aim to prevent or minimize pain. We often provide a type of anesthesia that either completely prevents pain or makes it much more tolerable. There are several types of anesthesia. There's general anesthesia, regional anesthesia, and sedation type anesthesia. And all of these have different sort of levels of intensity. Where general anesthesia prevents pain completely and awareness, regional anesthesia prevents pain in a specific part of the body, and intravenous sedation or sedation anesthesia allows for a process that would generally be considered quite uncomfortable to be much more tolerable.
That's perfect. And
so our purpose is to safely navigate the perioperative period with the patient, ensuring that they're stable and that they're comfortable, if not completely unaware.
Yeah. And with that being said, because I did not know, that's a new thing for me to learn today. But there's different types of anesthesias, right? That you can undergo. Now, since there's different types, how do you decide which patient is going to take which one at any given time?
So the decision-making process depends usually, most importantly, on the type of procedure that's being done, because one of the main roles of anesthesia is to facilitate surgical procedures. So procedures that are more involved or extensive or expected to be very painful often involve a general anesthetic, particularly procedures above the waist, where you require a deeper level of anesthesia for the patient to tolerate it. So general anesthesia is employed for those sorts of procedures. Procedures that involve a limb, for example, as an isolated thing. For example, if you have a fracture to your wrist, or, a lump or a lesion that needs to be cut away or excised from your foot. These procedures can be performed under a regional technique where you you block the nerves or you inject local anesthetic around the nerves responsible for pain sensation in a specific area that you're working with, so that they don't have pain. And then, of course, intravenous sedation you would use for more or less invasive procedures like colonoscopies or small procedures that would generally be considered uncomfortable, but where sedation offers you that, ability to take the edge off.
Yeah. Now, Carl, I got to ask, man, this is a scary word to hear. And if you're going for surgery or preparing, depend on the scale of surgery that you're going to be doing. How do you prepare for this job? And how do you make a patient feel comfortable knowing what they're about to get into?
So the preparation process starts well before the actual time of the surgery. There is, in addition to the preoperative surgical visit where they discuss with their surgeons what procedure is going to be done, and they sign their various consents, and they have a discussion in terms of risks and benefits, and they come to the decision about the surgery. There is also a period where they meet with the anesthesiologist in the preoperative setting. And that's the preoperative visit. And that is extremely important. That's where we take the opportunity in a calm and relaxed environment to gather as much information about the patient as possible. One, where we delve into their medical history. We want to identify risk factors, things that need to be optimized. For example, if you're a diabetic, we want to make sure that your blood sugar is well controlled for a planned surgery. If you are hypertensive, we want to make sure that your blood pressure is within a safe range to ensure that we can safely navigate the period where you are under an anesthetic and afterwards in a way that minimizes the risk of a heart attack or a stroke, for example.
Yeah.
We want to make sure that we identify all the medications that you're on, because some of those medications can interact with the anesthetics. And so we have to plan how we're going to either interrupt or change medications in preparation for the procedure. We also want to look at your baseline blood work often, depending on the patient's age and their list of illnesses or their current health status, just to ensure that everything is optimal. We want to make sure that the period is as safe as possible. And the start of that is to gather as much information as possible. It's also an opportunity for us to have a very in-depth discussion with the patient, providing them with details around the anesthetic so that there are no surprises. And patients are often very fearful. Anesthesia is mysterious. The surgery is a bit mysterious. I mean, despite having details discussed with them, there are a lot of unknowns or a lot of fear of what they can't anticipate. So it's an opportunity to discuss in detail what they can expect so that there are no surprises, which does go a long way to help to reduce the anxiety, and also to identify misconceptions or questions that they may have about their anesthetic, so that we can sort of fill in the gaps and have everybody on the same page, so that when they leave the preoperative anesthetic assessment, they're confident that they know what the plan is, that all possibilities are accounted for, and that they're going to be managed by a team that's well prepared to safely navigate this with them.
You mentioned something really important before, just making sure that you know the patient's condition, their history. Or I give you an example. A patient may come in with is diabetic. Now, for a lot of patients, especially men, I like to say Caribbean men, a lot of times we don't go and get checked up to know that we are diabetic, right? So is there checks done beforehand just to make sure that that individual may be suffering as a diabetic? Didn't know, and that's the first time they're finding out, because there's a lot of things that you say that they're crucial to making sure they go on the surgery. You're checking, you're doing all the checks for your job. But is that one of those things that's blood work is done before any type of surgery, obviously, right?
Absolutely. So blood work isn't done for everyone. We do choose or select which patients are most likely to require blood work. There is a protocol that we provide to the surgeons who meet the patients before us, as you can imagine. And so routine sets of blood work, depending on your age or your medical history, your pre-existing medical history, are done. And that goes a long way to catch those patients that are undiagnosed. And we actually do end up diagnosing many patients, not like a very large amount, but it does happen relatively frequently that we will identify problems that were not previously on the radar for those patients.
Yeah.
And it's useful. This is all done before they meet us. So by the time they come to us, typically they have their blood work and results there for us to review with them and discuss any concerns or anything that needs to be addressed, whether they need to be referred to an internal medicine specialist or an endocrinologist or the cardiologist, for example, if there's a concern regarding heart function. So all of that is typically identified during the process between the surgeon and the anesthesiologist before the surgery.
And Carl, you'd be involved if there was a trauma surgery that needs to be done, right? Like
Absolutely.
And
that's actually one of my specialties.
So wouldn't that be quite difficult? Because obviously we're talking trauma. That's coming in record time, right? And you have to kind of like think on the spot. How does that work for someone that doesn't understand?
That is very different, and that's a very good point. So up until this point, we've been discussing the process for elective surgeries. Emergency surgeries obviously don't have that luxury of time. Now there is often some time depending on the severity of the cases, but I mean we live in Cayman. You know how severe these cases can be, particularly road traffic accidents. So it does depend on the intensity of the situation, but we're often able to at least gain the information from preoperative blood work and a quick history either from the patient or from patient relatives if the patient isn't able to provide us with that. It has to happen a lot more quickly, and so we have to prioritize the vital information that we get. So the most important things and sort of gauge the urgency of the situation to determine how much more information to collect immediately. Yeah.
Man, it sounds like a very complex job. Now, misconception, we have them all in our specialties, all in our careers. What's the biggest ones that you find in your role that you have to play?
There are a few common misconceptions. One of the misconceptions that I've identified from discussions with patients in the preoperative clinic is that the anesthesia is sort of a predictive strategy. For example, for general anesthesia, where we can only hope that the amount of anesthesia that we've provided will be sufficient for the patient. And that's something that we often have to clarify. The current practice for anesthesia allows us to, one, tailor the anesthesia to the specific patient, but also maintain the anesthesia. It's an ongoing process. It's not a one shot and hope for the best type situation for general anesthesia. And we maintain the anesthesia for as long as the surgery takes. So there's very little risk of there being more surgery than anesthesia.
Yeah.
Another concern that is often raised in the perioperative period or in the pre-anesthetic assessment is about awareness or feeling things that they shouldn't feel during a general anesthetic.
Usually.
There was a movie about that, I think, that made this really famous. I think, what was it called? Awake, I think.
Yeah, Awake. The whole time he was awake during the whole procedure.
Which is a terrifying thing. Anesthetic awareness is something that's very much on our radar. We're very aware of it.
Yeah.
And we have taken multiple steps across the years to improve technology and our medications to ensure that this doesn't happen.
Yeah.
The risk of awareness is typically very, very, very low. And we have multiple pieces of equipment that are there to monitor the depth of anesthesia to ensure that you're in the right plane of anesthesia to prevent that from happening. So that is something that we're often able to reassure patients about. The risk of awareness is very low.
Have you ever heard of it ever happen in any market?
Well, I've been doing this for a long time. I've practiced at 6 hospitals now. It is something that has happened. It has happened, and obviously there are specific risk factors or things that they can increase the risk of it happening. Whenever it does happen, there's usually a very, very clear sort of likelihood or possibility of it happening that you can discuss with the patient before. But it's very rare. I can count on one hand and have fingers to spare. It's very uncommon. And this is something, anesthesia, I've done thousands and thousands of cases.
Yeah. There's there's surgery going on. Like I would say there's thousands of surgeries going on around the world.
Oh yeah.
And
probably more than thousands.
Yeah. And for it to be minimum, it's good. It's good to know that we have professionals like you guys in the job. It's a very important thing to take on, very important job to take on, but also at the same time, the person that's doing the surgery, it's scary to think about that this could possibly happen. And one of the questions I was going to ask too was, have you ever heard of anybody waking up during a surgery because they weren't given enough of the dose?
Awareness, right.
Yeah.
So that's what I was mentioning before. It does happen. It can happen, but it's extremely uncommon.
Okay.
Because the very practice of anesthesia is geared towards preventing that from happening. So we tailor the doses of our medications based on the patient's age, their weight, and their comorbidities or other medical illnesses. The fact that we even take into consideration medications that they've been taking, how they can interact with the anesthetic. We have equipment to monitor brain function even during the anesthetic to like I said, ensure that we're in the right plane of anesthesia to prevent it.
Yeah.
So although it has happened in very isolated, very rare cases, it's extremely uncommon.
Wow.
Like I said, I can think of a few cases. It wouldn't even fill one hand if I was counting fingers.
That's good to know. It's really good to know.
Uncommon.
And listen, we're going to be right back with Carl Brown talking about his specialty and a very important day that's coming up on October 16th. We'll mention it again as we take this short commercial break to go ahead and pay some bills. This is Bobo 103.1 FM. All right, welcome back to the show. It is Bobo 103.1 FM, a show dedicated to all things HSA. We have the pleasure of having a special guest here in the studios. He's no stranger to the show before. He's been here with our good friend Chuck Taylor before, and he's now back to talk about his specialty. We're going to have him introduce himself again, the role that he plays, and of course, how long he's been serving at his current job now with HSA. Good afternoon.
Good afternoon. So I'm Dr. Carl Brown. I work at the HSA as an anesthesiologist and intensive care physician. I've been doing this for, 7 years consistently at the hospital now.
We love it, man. Carl, Dr. Carl, now I love that I get to call you that. I actually went to school with you. I think I was 2 years. Was it 2 years ahead of you?
Yeah, I believe years, yeah.
Yeah. Is this something that you always wanted to do? Do you always want to be in the field of medicine?
I wanted to be in the field of medicine from those days. I did plan to become a doctor, but anesthesiology and intensive care, that kind of just fell into place after I'd already finished my basic medical degree.
What is something you believed that you were going to do before, like in the field of medicine?
I was planning to be a general practitioner.
Okay.
I was just gonna live a small, simple, quiet life.
Yeah. What shift?
And work in a GP clinic. Not that GP work is simple, but it's a different pace than what I ended up taking on.
Somebody said it's I get to go home to my family. So I had a doctor here before, Sarah, I believe, and she said, I picked this role because I get to go home to my family.
Yes. So I thought, quality of life
Yes.
was my highest goal. I wanted to make sure I had as much time as possible for other things.
Yeah.
And GP seemed to be a great choice for that. And then, but I enjoyed the excitement of emergencies. So I thought maybe I would be an emergency room physician. And in preparing for that, actually, I just rotated through anesthesia and intensive care as a senior house officer after graduating. And I was like, well, I'm never leaving here.
Yes.
This is it.
Wow. And so you enjoy it. Well, we asked him before if he enjoyed. For those that are just joining us for the first time, he loves his job. Obviously, he's been with HSA for a while now, and this is something that he's always wanted to be in, the medical field. But I want to ask you, because your current role and your specialty, how has this evolved over the years? Let's talk about like the start of what you do now, your specialty, to what it is today in 2025 and your hopes for it in the future.
The specialty it's come a very long way. Anesthesia started with very dangerous anesthetic medications that caused very unpredictable effects. The mortality in anesthesia was very high, from the surgery and from the anesthetic. And to compound things, I don't think we even were aware of some of the risks that the patients were undergoing, related to anesthesia specifically. So the major advances in anesthesia have come with development of safer, more reliable medications. One, better monitoring. So we've developed all sorts of more effective and efficient ways of monitoring our patients to ensure that we can safely monitor the effects of our anesthetics and the stability of our patients.
Yeah.
And just the process itself, how we prepare our patients, that has evolved over the years as well. And all of those have come together to create a much safer product than it started as.
Yeah. You know what? I was reading this report. I talked about 101 jobs that may never be affected by AI. So there was like, it was 100, 105. I can't remember what it was. Your specialty actually came up. It said that this would be very, it would be a disaster if they depended on AI to run the shop. Now, it depends on how you look at that word when I say disaster, because could it coexist with a human being? I think it could, but you're the perfect person to answer that question.
Yeah, so that's a really interesting question. So there's a lot to be said for instinct and advanced pattern recognition, which is something that that an anesthesiologist relies on, in addition to, of course, training and protocols and, keeping within your guidelines of practice.
Yeah.
And AI does approach that. I mean, it's something that is very, very much on the horizon in terms of what AI can provide, pattern recognition and something that may akin or approach what we use as instinct in our day-to-day practice. Whether or not we'll be replaced, it's possible, but it's not. I don't think it's on the immediate horizon, like you said. It's not. There's a lot. It's far more complex than what current AI can feasibly provide. So I think we're safe for the time being.
Yeah. Would you believe in that, incorporating that in your specialty one day?
I think it's inevitable. I think if we continue on the current trajectory, AI is going to be incorporated into just about everything we do.
Yeah.
It's already being used in research and to analyze data. There are a lot of developments even now where we use computer systems to assist us in terms of managing anesthetics. For example, there's a closed loop sedation system that monitors the depth of anesthesia and adjusts the medications automatically. That's used for colonoscopies. I mean, we've never used it here, and it's not something that's been taken up as sort of mainstream practice everywhere, but it is on the market. And there's a lot of interest in integrating large language models into the practice of day-to-day anesthesia. Don't know what that's gonna end up being like ultimately. It's hard to say, but I think the future is gonna involve AI.
Yeah.
And we can either avoid it and I think to an extent limit ourselves, or we can let it do everything for us to the point where we start to lose our ability to do things independently, or we can do the best thing, which is to use it to take our own practices, our own processes to the next level.
Yeah.
So hopefully if it is incorporated, that's the direction that it'll take,
Yeah, we can all hope that it can be positive. I mean, there are certain roles that I think about today. I was having a conversation with some friends, and I was saying there's certain things for me, I don't want to sound negative, but there are certain things I just don't want to be replaced by AI. I would rather somebody coexist with it, like work along with it as a human being. Absolutely. But there's certain, like for instance, like a pilot, you just could not feel safe in an airplane knowing it's being, operated by AI. And doctors also. It's something about a human touch. In certain roles that you just need a human touch. And I think doctors are one of those things where it's like, I would hate for an AI robot to come and explain to me something as serious as cancer or as serious as a surgery. I just can't imagine it. So I wanted to ask that.
No, yeah, it's important. It's important for us to remember that we're physiologically designed to interact with each other and provide for each other.
Yeah.
Even just a basic human touch as a physiological response in another person.
Yeah.
And I don't think we'll ever reach the point where AI is as adept at reassuring another human as a human can be when a human decides to be reassuring.
Yeah, exactly. And that leads us into our next question, to prove just how important your role is. Can you tell us about some of your most memorable experience? You can pick one or two, or a challenge that you may have had in your role before.
I think
a challenge that you overcame too, by the way. I just don't want to say challenge and then put that on you like it was just a challenge. Maybe something you overcame.
How I'll answer this.
Yeah.
As you know, Cayman is a really small place.
It is.
So I'll leave out specifics. But what I will say is that one of the challenges that we often meet as anesthesiologists is being able to offer calm in a stressful situation. For example, in an emergency situation where a patient requires emergency assistance, either for anesthesia or critical care, which many of us wear both hats. It's important that we try to be the calmest presence in the room, and it has an immediate and very meaningful effect on patients and patient relatives, and even on other members of staff. Mm-hmm. So it's very gratifying to enter a high stress situation and add a little bit of calm and control to the situation.
Yeah.
To sort of ease tension. Another gratifying experience is being able to reassure patients that initially present to you very nervous and anxious about a procedure, where you're able to provide so much detail and so much insight into how every little concern or risk is considered and mitigated in the process of preparing them and navigating the anesthetic with them, that they feel much more confident leaving the room. So that's always gratifying as well.
Yeah, I love that. And memorable. You shared that. The challenge is also you can get too detailed into it. It's a very small island, so people automatically will put a name to it.
Names, you describe a situation too specifically, I'd be like, that was that down the road,
Yeah, believe it when I say this to you. It has happened on this show before. So, without saying names, we just mention the circumstance. Maybe one of the teams that works for the ambulance is a perfect example. They may have mentioned something approaching the scene on this specific day, and all of a sudden we have calls. So, respect Dr. Carl for that. What advice would you give to a patient? I felt like we have detailed this before in our first half of the interview. We want to kind of reestablish it again. What advice would you give to a patient who was nervous about going under surgery with anesthesia?
So one of the first things that I would say is that being nervous before you go in under anesthesia is perfectly normal. And it would be useless or not very helpful to tell a patient to just not be nervous. In fact, it's impossible to not be nervous, at least to a certain extent. Whenever you go under anesthesia, you're giving up a certain level of control. It requires a certain amount of trust. There's a team that's going to be doing a lot of things that you're normally accustomed to doing for yourself. It might even include breathing for yourself or maintaining your own blood pressure or, things that you normally wouldn't trust anybody.
Yeah.
And when you give up that level of control, the natural response is to be anxious. But on the flip side of that, you also want to reassure them that we're aware of that. And that there is an entire team there that's dedicated to navigating that with you safely. And then you want to provide as much detail as possible to them in terms of how you're going to be doing that. So what I would say is it's okay to be nervous.
Yeah.
I tell a lot of the first time anesthetic patients, this is your first time and that's understandable, but just remember that it's not our first time.
Yeah.
And that's really important.
Well said. Now you spoke about your role. Obviously, the every change in technology, where you hope for it to be in the future. I never spoke about your team. You obviously work with a team.
That's right.
Can you tell us a little bit about your team and your department at HSA?
So, our team consists of anesthesiologists. So there's a fairly sizable group of us, and anesthesia technicians. So that's the main anesthetic team. That being said, we work as part of the larger perioperative team, which involves, of course, a surgeon, your scrub techs and surgical assistants, and the nurses in the operating room. And that team, it's a well-oiled machine. We all serve our purposes. We're all more or less familiar with the various portions or components of our roles, and the roles are completely interdependent. And what makes the team effective is that we work together as one unit when we're surrounding a patient.
Yeah.
When we're taking care of a patient.
Love it, man. And what does your day to day look like? Like we spoke earlier about the role that you wanted to play in general practice before you get home to your family. How is this compared?
It's not the same. Yeah. I do manage to maintain some sort of work-life balance, but it's a little bit more energy and time intensive than general practice. We do work longer hours sometimes because of our on-call duties, which can last 24 hours, and then we extend sometimes to go beyond that, depending on whether or not it's a weekend or a public holiday. So we practice in several different areas. Anesthesia, we provide anesthesia in a number of different areas, and we also service the anesthetic preoperative clinic. So on any given day, you'll either be assigned to the anesthetic clinic where you spend the day with patients preparing them for surgery.
Yeah.
Or you may be assigned to the intensive care unit because, like I mentioned before, most of us wear two hats. We're also intensive care physicians. And so we'll either be assigned in the intensive care unit where we provide critical care management for patients, or in the operating room on elective lists, which are lists that are scheduled non-emergency surgeries.
Yeah.
And then there's the emergency list. And the emergency anesthesiologist covers emergencies in critical care, emergencies in the emergency room, in the operating room, or any other area in the hospital where an emergency can arise, where anesthetic expertise is required. And then, of course, there's maternity coverage as well, which is usually for epidurals specifically, to relieve pain in active labor for mothers.
Yeah. Listen, I want to ask this is one, it wasn't on the script. So just for those that are listening, that I'm going to divert from the script a little bit. It's an important one because I think a bad day for me in media is when I hear about a bad story that we have to bring to the airwaves. And we got to try to figure out how to express that story in such a way where we're not showing how gruesome it is or how gruesome it was, right? Now, for you, this is your day-to-day life sometimes. You get to see a lot of things inside that room that are unimaginable for some people. How do you deal with that? How do you that's a
good question.
Yeah. Because I always wonder with doctors, like you guys, you have a tough job, because I have met doctors before that have to go through a traumatic situation but still have to come out and show no emotions. And I know a doctor told me before, it's not that I don't have emotions. It's just a role. It's tough skin. This thick skin that I built up.
It's really important. Because we certainly can't ignore the fact that we have emotions and we're people too. I think specialties that are exposed to traumatizing events they often select for people that are tolerant to a certain extent of this sort of exposure. That being said, it does have an impact, and everybody needs to every now and then kind of decompress, and we, depending on how traumatic it is, we have formal processes sometimes to handle that, where we meet afterwards and we have debriefings where we discuss what had happened, how it made us feel, what we think could have gone differently, or how things could be improved in another situation in the future, and just sort of to attend to one another.
Yeah.
As a community. So that does happen. It's nobody's immune, to that sort of trauma.
Yeah. Do you set up a time that, like, you have something out there? Like for me, if I have bad days, I know that there's something that brings me joy, whether it be going to the beach with my family that day because I've had a bad day. There's things that set up in my life that takes care of my mental, because I know that there's going to be bad days. Mm-hmm. How do you deal? Like, what brings you joy outside of work? Like, what do you do? What's your hobbies? What relieves the stress?
I exercise.
Yeah. Yeah. You've gotten bigger since high school. For those that didn't know Dr. Carl Brown, he was skinny. And now looking at him, I'm surprised. So that's something that you enjoy doing on the side.
It helps. It helps to regulate, regulate your emotions, and it helps with sleep and whatnot. So exercise is really important. Spending time with family is really important. Your kids, spend time with my wife, and ride a motorcycle, things that make you feel alive.
Yeah.
Yeah, more or less like anybody else, I suppose.
Yeah, I love that, man. Dr. Carl Brown, when we come back, we'll talk more about his specialty and giving advice to youngsters that perhaps want to join this field one day. We'll talk about it as we close out this interview here on Bobo 103.1. And we are back. Welcome to Bobo 103.1 FM. I am your host, Dane, a very special show for the HSA team. Like I said before, guys, we usually have discussions here on this, a specialty, a field, maybe a conference is coming up, or a special day that's going to be celebrated. We talk to our doctors, we talk to our nurses, we talk to the experienced teams of HSA. There's so many different dynamic about HSA that sometimes it goes unnoticed, or they never got to tell their story, right? So we love to bring them on, and we usually do a 1-hour interview just before the BBC show and just discuss maybe areas that the public needs to be aware of, or different functions that are coming up, or just like Dr. Carl Brown, who's joined us here in the studios, he gets to talk about his specialty. And maybe there's some things that you want to ask. Maybe there's some questions throughout the interview that you did not get to hear, you can message us. We've always said this. Send us a message on our social media at Bobo 103.1 FM. Just hit that message icon. We will get that question directly to Dr. Carl Brown, whether it be this week or sometime next week. We'll definitely pass it on, and I'm pretty sure he will be grateful enough to answer those questions. Carl Brown, would you introduce yourself again, your specialty, and how long you've been with the hospital? I know it's become repetitive.
That's all right. I'm Dr. Carl Brown from the HSA. I'm an anesthesiologist and intensive care physician, and I've been working consistently with the HSA for 7 years.
Now, we've been asking a lot of questions, and one of the ones that we want to ask here is, how do you manage paying for patients post-surgery? And what role does anesthesia play in an overall pain management strategy?
Okay, so we manage the post-operative pain. That management begins intraoperatively and sometimes preoperatively. So it's really important that patients are provided with the right doses of medication at the right interval for pain during the anesthetic before the procedure is even finished, to ensure that a pain cycle isn't created where the pain becomes sort of a runaway train post-operatively. Nobody wants to wake up in severe pain after an anesthetic. And so we strive to prevent that. Now, every patient's a little different. Everybody processes pain differently. So inevitably, sometimes patients do wake up experiencing some pain, but we put measures in place to ensure that we have medication ready and waiting to be given as quickly as possible to make them as comfortable as possible, as quickly as possible after the procedure as well. So they're loaded with pain medication while they're still asleep, and any top-up that's required is readily available right after the procedure as well. Depending on how painful we expect the procedure to be, we have adjuncts that we can provide that can be given and used for 24 to 48 hours after the procedure, even longer sometimes depending on the case. Patient-controlled analgesia devices, so machines that allow the patient to push a button whenever they're having pain, and they're automatically given a dose of medication via IV access. Of course, programmed to prevent overdoses, and there are lots of safety measures in place, but that helps to shorten the time between experiencing pain and getting pain relief. So that is the mainstay for patients where we would expect severe or significant pain. There are certain medications that we can use that can help with pain control for weeks, even months after the procedure if they're used during that interim perioperative period. And so those are often employed as well.
All right. Love it, man. Also, we know that there's a special day. Thank you so much for answering that question too, by the way. We know there's a very special day coming up, October 16th. Can you break down this day, Anesthesia Day? And what is the awareness around it? And what does this day mean to you?
Okay. So World Anaesthesia Day is October 16th, and it's a day that we want to take the time to acknowledge the specialty and the value that it brings to the perioperative period, the value that we bring to patients that are navigating the surgical process. It's a day that we want to take to acknowledge the challenges that are faced and the community of people that have dedicated their lives and their practices to navigating these challenges along with patients.
Yeah.
It's a day to thank your anesthesiologist,
Yeah, and October 16th is this a date to mark it down in your calendar. Is there anything special that HSA is going to be doing on location, or is just pretty much an awareness around
it's more awareness than anything else? We will have a academic grand round where we're going to share that, I think, with the emergency room department on Friday, where we in commemoration of World Anaesthesia Day, where we'll discuss various topics of interest. But it's really just for us to be aware of the value that we bring to the perioperative period and our value to medicine and the community on the whole.
Yeah. Now, a very important topic that we discussed today, and we want to thank Dr. Carl Brown for stopping by, but I would be wrong not to ask this question to the next 15, 10-year-old or 18-year-old, 17-year-old, wherever you are in your age. You may be deciding on what your career is going to be looking like very soon in the medical field, or maybe you just didn't even know that you had an interest in the medical field until you hear Dr. Carl Brown speaking today on the radio waves. What advice would you give to the next youngster coming up behind you?
I would say that to be an anesthesiologist, it requires quick thinking, a calm sort of spirit and clear-headedness in periods where things are a little chaotic, to prepare for it. I mean, it is many years of preparation, but it just requires focus and hard work. If it is something that you're interested in, by all means, come and have a chat, and we can talk about, the ins and outs of how to navigate, becoming qualified as an anesthesiologist and what that'll take. It's an interesting career. Never a dull moment, really.
Yeah.
Although it would appear so, but it's not.
I was going to ask you before if you're full of surprises on different days. It's never the same day every day, right?
It certainly isn't. Every patient's different. Every anesthetic is different.
Do you have quiet days?
There are quiet days, or days where things go as you would expect them to. But even then, this is still navigating the whole process with patients that are all unique. So even when it's quiet, it's still interesting. Yeah,
still something going on. Now, let's talk about, just before you go, I want to ask all the right questions for the youngsters in the car. What should you be focusing on in school if this is a career path that you want to take? Like, what subjects are you saying, I want to make sure I take this subject, and maybe even give them an example, kind of like a little bit of a mentorship moment on where to consider schooling-wise, especially coming from the Caribbean?
That's a good question. Okay, all right. So first of all, in terms of subjects, the sciences are really important for this. Chemistry, biology, mathematics, physics, those are all very heavily leaned upon, and there will be requirements in some form or another at the university level. It may not be all four of the sciences. I think it depends on the university, but at least 2 to 3, and typically 3 of those 4 will be required to enter an anesthetic program. In terms of where to practice, I usually tell students that where you train isn't as important as your mindset. You can become a great anesthesiologist or a great physician, coming from any institution. We have institutions within the Caribbean that offer anesthesia training and basic medical training. The University of the West Indies, and there are a couple of offshore places that provide basic medical training, but University of the West Indies provides an anesthesia and intensive care specialty program, which is quite robust, and it does prepare you adequately. I mean, that I'm a product of the University of the West Indies.
Oh wow.
Anesthesia program. And but other places provide the training with other advantages. So you're close to home in the Caribbean. You do get to see a wide variety of pathologies and a lot of hands-on experience. In the first world, in the United States, Canada, you get access to a lot of the resources that are a little bit harder to come by in the Caribbean.
Yeah.
That changes your experience as well. But your clinical experience, your hands-on experience is comparable between the two. I got, I suppose, the best of both worlds because I trained in the Caribbean, so I got a lot of that hands-on experience, and then I went to Canada afterwards to do fellowships, which added to the experience. Either place has its benefits and drawbacks. Like I said, it depends on the student, but the student makes the career, not the institution.
Yeah,
I think that's really important.
It's well said. Well said. How long did it take you from leaving? Because you have to go to the university stage first, right?
That's right.
Yeah. So get up to at least a bachelor's, is it, or a master's?
So it's a bachelor's in medicine and a bachelor in surgery. So I have an MBBS degree.
Okay.
That's a basic medical degree. And then I did the DM, which is a doctorate program in anesthesia and intensive care. And then I did a couple of fellowships. So from start to finish, I started in 2004 and I finished in 2018 with a gap year in between. So about 13 years for me. But to become an anesthesiologist, you're talking at least 10, 11 years from start to finish, from leaving high school. And that's a minimum, because in the US, of course, you have to do a first degree before you can enter a medical program.
Yeah.
So it's a little different there.
Yeah.
But for the UK, British system, the Caribbean, you can go straight from high school and get started.
You definitely have to love this, folks. 100% have to love this.
Yes.
Dr. Carl Brown, thank you so much for stopping by the the Bobo Studios. I'm sorry. And just blessing us with your knowledge today. We really appreciate your time and what you're doing. And, for me, I can only say from my standpoint, I'm pretty sure friends and family have said this to you, to see where you are right now in your career. It's a proud moment to see you coming from where you are in high school and who you are today. Yeah. And how you articulate yourself too. Job well done. And it's good to see. It's only a benefit that you're a Caymanian, doing this, but, for someone that you actually saw from the beginning, and see now to the stage that you are, it's a proud moment, man. It's a proud moment.
Thank you, and thank you for having me.
No, it's a pleasure. It is a pleasure. Guys, thank you so much for being a part of the show. Once again, if you did not hear an answer that you are looking for, because we know we have a lot of people sometimes that use our social media as an avenue to get question answered. So please go ahead and feel free to go ahead on that Instagram site or our Facebook. Just hit the message icon and hit Bobo 103.1 FM. We'll get the question straight to Dr. Carl Brown.